can do for their newborns. But it doesn't mean breastfeeding is easy. We're talking about this as part of Women's Health Wednesday today. So many do struggle and they give up because of the challenges. Many are unaware that there are medical issues that can affect lactation. So here to talk more about it and the help and support that's available in the medical community is Dr. Laura Michaels, a board-certified breastfeeding and lactation medicine physician. Dr. Michaels, thanks for coming in this morning.
Thank you. Thank you for having me.
We had a great conversation on the phone the other day, and we were talking a lot about just how different what you do is from a lactation consultant. So explain that for our viewers here.
So breastfeeding lactation medicine physicians, most of us are now getting to be board certified in breastfeeding lactation medicine, which is new. And we have a medical background. We're all physicians. We are able to diagnose and treat any kind of medical or issues that could affect breastfeeding and lactation and could help both mom and baby. And so we take care of some of the prescriptions, we prescribe medications, we do medication management, anything that can affect breastfeeding and lactation, or if any moms and babies have any medical issues that can affect breastfeeding and lactation.
And we're going to talk about that in just a moment, but I do want to stress this too, because we know there are the breastfeeding cafes. We know there are great lactation consultants out there, but sometimes it's just not enough. And we were saying that you have women tell you something very specific when they come to you and they were looking for help. What have you been hearing from women?
Most of the time when I have them in my office, they say, why didn't I not find you sooner? Why did I not hear about you? And I had no idea that breastfeeding lactation medicine physicians were a thing.
Yes. And you're finally able to get them the help that they need and get over that hump. So let's talk about the medical issues here, because there are a bunch of them and people may not realize that this can affect you being able to breastfeed. What are some of those?
So many mothers who have any kind of medical issues such as diabetes, thyroid issues,
I think we have those. We can put them on the screen.
Any kind of, if they have postpartum depression, if they have PCOS, which is polycystic ovarian syndrome, they have any kind of past fertility challenges, if they have any scheduled inductions or C-sections that they know they're going to have, any kind of hypertension, maybe they have a prolactinoma, or they have postpartum hemorrhage, which can happen after delivery sometimes.
Yes. So if you have some of these different medical conditions, are there ways that you can get them to a place where they can still breastfeed when baby comes?
Oh yes, definitely. So a lot of times if you have any of these conditions that you know you're going to have them, it's great to have a prenatal exam and to come into our office and have that medical evaluation and come with a treatment plan that we can focus, and so that we can get things started off right away, right afterwards, so you're just ahead, hopefully.
So how can people find you? I know you're right here in Albany, but just give us some of those details. And I know you accept most insurance.
Yes, I accept most medical insurances, and I'm located in Albany, and I have my own breastfeeding medicine clinic. We also have a IBCLC who also works in office, and so you can just go ahead and we have a website, and go ahead and give us a call and schedule.
You're changing lives here. I mean, just speak to just how fabulous it is when somebody can do this for their baby. It's so important, right?
It is very important. It is very important. And it's so good to have a plan going in, and especially if you want to breastfeed, to have that, go ahead and have that in plan.
Thank you so much, Doctor. Appreciate you coming in.
Thank you so much.
This is a great resource for people, and we'd love to spread the word for everybody. For more resources and to find all of our Women's Health Wednesday segments online, you can go to news10.com. Look for Women's Health under the Community tab. We'll be right back.
You're watching News